Health Reach webinar series, Research, Education and Advancement in Community Health. I am Jhalak Dhingra and it is my privilege to host today's webinar. Effective public health action depends on timely and reliable information, and surveillance systems are ones which help us to detect health events, monitor disease trends, and respond to public health challenges in a timely and effective manner. Keeping this in mind, today's webinar focuses on the theme Enhancing Surveillance System for Improved Health Outcomes. Through this session, we'll understand how strong surveillance systems contribute to better public health outcomes. With that, I would like to introduce our speaker for today's session, Ms. Mansi Rajput, who currently serves as District Epidemiologist in Devbhoomi Dwarka. She has been actively involved in disease surveillance, outbreak investigation, emergency preparedness, and capacity building initiatives for healthcare workers. With that, I invite Ms. Mansi Rajput to kindly begin her presentation. Mansi, it's over to you.
Hello, a very good afternoon, everybody. I hope I'm audible.
Yes, you're audible.
Okay. So I'll just present my screen. Is my screen visible?
Yes, it's clearly visible.
Okay. So a very good afternoon, everybody. I am Mansi Rajput. I am currently working as an district epidemiologist in Devbhoomi Dwarka in HM Gujarat. It is my privilege to present a best practice initiative undertaken by the IDSP cell Devbhoomi Dwarka under the category of surveillance system strengthening. So the theme of our initiative is notification by private laboratories and clinics. I would also like to acknowledge the guidance and leadership of the district officers whose continuous support has been an instrumental in the success of this initiative. So without wasting much time, let's dive in. So, disease surveillance forms a backbone of an effective public health system. Timely reporting and all the early detections of the disease, this plays a very essential role in controlling any outbreak, coming up with the strategies for deciding the interventions and safeguarding the community against any disease outbreak. However, a significant number of patients seek treatment from the private healthcare facilities. So, therefore, a strengthening collaboration with the private sector also becomes essential. Keeping this view in mind, the IDSP cell of Devbhoomi Dwarka initiated a mechanism for engaging the private clinics and labs for the notification of vector-borne diseases, infectious diseases, and vaccine-preventable diseases. So the primary aim of this initiative was to strengthen disease surveillance through active engagement of private sector, private clinics, other labs. The key objectives um, were to strengthen and streamline the reporting of the notifiable diseases from the private facilities. So in today's healthcare landscape, a large proportion of the patients seek healthcare from the private clinics. They go for the treatment directly to the private clinic. As a result, a significant amount of disease-related information remains outside the routine government reporting system. So, this leads to delay in the disease detection, outbreak identification, and public health response. Therefore, the aim of this initiative was mainly to strengthen the surveillance through active engagement. So, this helped us to create a more comprehensive picture of the disease burden also. The first objective was to establish a structured mechanism through which the private clinics and labs could regularly notify the diseases. This helped us to bridge the gap between the public and the private healthcare reporting system. Also, it ensured that the valuable disease information is not missed. Secondly, timely notification enabled us to identify the unusual trends and potential outbreaks that can occur at an early stage. So this helped us to look at the field investigation also, implementation of control measures also, and the better allocation of the resources in long run. Third, one of the major barriers of reporting is the complexity of the reporting systems. We have so many portals around. We have 50 portals in our government system. So private practitioners are usually busy and they keep mostly their records in a manual way. Therefore, we were aiming to create a reporting mechanism that is easy, that was accessible for them, that was convenient for them while working, while they are seeing patient, while they are in OPD. So we were trying to come up with a mechanism which was easy for them. Fourth was accurate and timely data are essential for evidence-based decision making. So by collecting the real-time information from both the private and the private sector, we were able to monitor the disease pattern. It was very important for us that we are getting the information on a real-time basis. So this also came up as a challenge for us to collect the information on a real-time basis. I'll discuss that in further slides. Fifth was to foster public and private relationship in disease surveillance. So another important objective was this only, to build a good relationship between the government health services and the private health providers. So with such partnership, we were able to enhance the trust that the data they are providing is confidential with us, is maintained, uh, and and it is not leaked anywhere, which finally led to a stronger and a more resilient surveillance system. So, talking about details of the initiative, to achieve these objectives, we were continuously liaising and coordinating with the established private health clinics and the diagnostic laboratories across the district. First, we used a Google Sheet with the prescribed format, including demographic details of the patient, specifications of the problems and diseases they are facing, and the provisional diagnosis was also included for the private clinics. On the other hand, for the laboratories, we included the test performed and the result section also. So after analysis and getting feedbacks, we observed that it was time taking and tacky for the private practitioner to fill the data in the Google Sheet while they are in the OPD, while they are treating the patient, while they are diagnosing the patient. It was very difficult for them to go into the Google Sheet and enter the data on the real time basis. So after we got many feedbacks, so after recognizing the importance of simplicity and accessibility, um, we made a dedicated WhatsApp group where uh, disease notification by the private practitioner and laboratories were done. So this provided a common and convenient platform for sharing information. Data that was received from both the government and private sectors was compiled afterwards and analyzed together. However, we do not report the data which we get from the from the private clinics. We do not report it on the government platforms, but we use the data to analyze. As data confidentiality is very important, so we analyze the data. We use it for our strengthening surveillance system, but we do not report it on any government portal. So, furthermore, talking about the challenges, early action and outbreak investigation was very important. So, initiative which we were taking, it obviously faced many several challenges. Firstly, the user adoption and training was very important. As I mentioned, we used a Google Sheet, which was very hectic for the private practitioner. They were very unfamiliar with the reporting. However, on the IHIP portal, we have now a community reporting system also, but it was difficult for us to maintain the data. So district level Excel databases are maintained. We assign the task to one of the employee here to maintain the data, who maintain the data in Excel files. Every single patient who is notified is maintained by our staff here systematically, and then the analysis is done with the received information. Fourth, ensuring that the expected public health measures were taken. Compiling data and do not doing the analysis and do not taking actions about it will go into the field. We go and visit to the CHOs. We train them how to handle the situation. If private notification of any malaria, let's talk about malaria. If any disease, private notification is more, then we guide them what to do and what are the other field measures that they can take. Finally, the analysis of surveillance data, it was very pretty easy. Continuous data analysis also we were doing, so it helped us to understand the disease trend and patterns. So by now we know that the measles cases will be mostly observed between January to April, May. Most of the 50% of the measles cases are reported during this time only. So this helped us to understand the disease pattern also, and thereby strengthening evidence-based decision making. So outcomes, talking about outcomes and achievement, it has yielded us several positive outcomes. It has significantly strengthened the supervision and enhanced the disease surveillance activities throughout the district. This reporting mechanism, I tell you people, it has also acted as a valuable feedback system regarding the function of the field level staff. It helps us to verify if the people in the field are working or not. If we are getting government notification from our field staff that only two malaria patients are found in their area, but the private are notifying us more than 10, more than 50. So this helps us to verify whether they are doing their work in the field regularly or not. Also, uh, accountability among the health workers have improved. Now they are afraid if we get a notification from private groups and not from the government, we question them. Okay, what are you doing in the field? If we are getting this much notification from our private clinics and labs, what are you doing? Why are notification not coming from the government authorities? So this helped us to provide accountability among the healthcare workers also. This also helps us to create a more structured and supportive supervision system among the healthcare staff. As you can see, impact was very nice. A comparison of cases notification during 2023 and 2024 was done, and it is demonstrating a marked increase in reporting from the private facilities. So this clearly highlights the growing participation of the private sector. At present, if I talk, we have 9 reporting units from Bhanbad Taluka, 3 reporting units from Kalyanpur Taluka, 39 reporting units from Khambaliya, and 11 reporting units from Okha. So, for hard to reach areas like Okha, these private facilities play a very vital role. So, their contribution is substantial in notifying presumptive cases during outbreaks. So, it has helped us uh, very much in timely investigation and response. Okay, this is a stakeholder engagement meeting. Regular meetings was also conducted by our district staff with the private clinic and laboratory owners. These meetings also serves as a platform for the discussion, feedback, and strengthening partnership between the public and private sectors. So, such collaboration has played a vital role in building the trust and promoting active participation. This is some of the picture of the early action we have taken based on the data we have got on the from the private clinics. So timely notification was done. Hence, we were able to identify early outbreak, and even we were able to stop some of the many outbreaks like measles, malaria. We have even able to stop those outbreaks with the help of these notifications because of the prompt implementation of control measures. So this has helped us to reduce the delays in response and also strengthen the district preparedness to tackle emerging outbreaks. We also recognize and motivate our partners to encourage and sustain participation. A system of quarterly appreciation has been introduced. We provide this certificate to the private facilities that consistently report notifiable disease in a timely manner, and then they are recognized and appreciated. So this not only motivates the healthcare providers but also creates a sense of ownership and responsibilities among the private health practitioners towards the surveillance, towards their role, what uh, what they are helping us to tackle. So they also recognizes their responsibility and ownership in that. Talking about the way forward, we are thinking to propose the development of a dedicated questionnaire on the ODK platform, which will improve the quality uh, and the completeness of reporting. Maybe in the coming year, in the coming months, we will introduce that using the ODK platform. So this digital approach will also reduce the burden of manual data entry, maintenance of Excel files, thereby requiring less manpower because we have a employee dedicated only for this, who is maintaining all the Excel files from the for the private notification that we are receiving. So obviously it will help save the time. So we also plan to identify the map and private facilities that are not yet integrated into the surveillance network. So we have not included any QAP into our network. So we're thinking them. We are thinking to include them also, so that we get a comprehensive data from the field. In addition, the private healthcare facilities are now being incorporated onto the IHIP portal, as I mentioned, which will further strengthen our real-time disease surveillance and reporting. So, in conclusion, the experience of Devbhoomi Dwarka demonstrate that the this engagement is very meaningful and can sustainably strengthen the disease surveillance. Through collaboration, timely reporting, supportive supervision, and giving recognition for good performance, we have been able to build a more responsive and effective surveillance system in the district. This initiative represents a significant step towards achieving a comprehensive and integrated public health surveillance system that is ultimately contributing to protecting the health of our communities. Thank you very much for your kind attention. I shall be happy to answer any questions now.
Thank you, Mansi, for that insightful presentation and for sharing your valuable experience with us. We'll now move to question and answer. Participants are invited to share their questions through the chat box. So if anybody has, please feel free to type in the chat box.
Okay. I don't think there are any questions. So
Are there any questions from participants?
if there are
Please,
many afterwards, they can reach out to me on the mail ID also.
yeah,
I will
yeah,
mention my mail ID.
okay.
I will give it to you. You can mention it.
Yeah, yeah, okay, I'll do so. So, as we conclude today's session, I would like to sincerely thank Miss Mansi for sharing her valuable insights and experiences with us. I also thank all the participants for joining us today and showing their engagement throughout the webinar. We look forward to welcoming you for future episodes of Health Reach webinar series. Thank you, everyone. Have a wonderful day ahead.
Thank you so much, Jalak, for having me.